I am Dr. Sarita, Professor of Anatomy. I'll be discussing the hilum of the lung. Hilum of the lung is present on the medial surface of the lung. Hilum is a large triangular depression located superior to the center of lungs mediastinal surface and posterior to the cardiac impression. Anteriorly, the hilum corresponds to fourth to fifth costal cartilages. Posteriorly, it corresponds to fifth thoracic to seventh thoracic vertebra. The important structures which enter and exit the lung is via the hilum. First of all, it is the bronchi. This is a principal bronchus which enters the hilum, which is derived from trachea at the bifurcation of trachea, which occurs at the fourth thoracic vertebra. The second important structure are the pulmonary arteries. Pulmonary arteries are the branches of the pulmonary trunk which arises from the right ventricle and carries deoxygenated blood to the lung. The third important structure is the pulmonary veins. These pulmonary veins start as tributaries from the alveoli and finally reach the left atrium. They carry oxygenated blood to the heart. The other important structures present around the hilum, we have the bronchial vessels, the bronchial arteries which and bronchial veins which nourish and drain the lung, lymph vessels, lymph nodes, and finally autonomic nerve plexus, sympathetic and parasympathetic. Coming to the relations of the hilum from above downwards, which differs in the right lung and left lung. The most superior structure on the right lung is the eparterial bronchus. It's a superior lobar bronchus. The second important structure is the right pulmonary artery. Next comes the hyparterial bronchus, which is the main or the principal bronchus. And lastly, the most inferior structure is the right inferior pulmonary vein. On the left side, we have the most superior structure is left pulmonary artery. Then we have the hyparterial bronchus or the principal bronchus. Most inferior structure is inferior pulmonary vein. So on the right side we have four structures. On the left side we have mainly three important structures. Inferior to the inferior pulmonary vein we have the pulmonary ligament. It is a dead space which allows the dilatation of the pulmonary veins. Now next coming to the relations at the hilum from anterior to posterior. These relations are similar on the right lung and left lung. The most anterior structure on the right lung is the right superior pulmonary vein. The intermediate structure is right pulmonary artery. Most posterior structure is hyparterial or the principal bronchus. On the left side, the structures are similar. So we start with the most anterior structure is left superior pulmonary vein. Intermediate structure is left pulmonary artery and most posterior structure is the hyparterial bronchus. Bronchus is identified by a cartilaginous feeling. The artery is thick-walled and the veins are thin-walled. The other important structures within the hilum are the space that is a pulmonary ligament which is inferior to the inferior pulmonary vein which is responsible for the dilatation of the inferior pulmonary vein. It is opposite the fifth to seventh thoracic vertebral bodies. Then we have anterior pulmonary nerve plexus and posterior pulmonary nerve plexus. These pulmonary nerve plexus are autonomic plexus consisting of sympathetic fibers and parasympathetic fibers. Sympathetic arise from T1 to T6 thoracic segments and parasympathetic are the right and left vagus. We also have the bronchial vessels within the hilum. Bronchial arteries, they arise from the posterior intercostal arteries. Bronchial veins which drain the lung finally drain into the azygous venous system. Lastly, we also have the lymph vessels within the hilum. Lymph nodes are bronchopulmonary group of lymph nodes. Coming to the cadaveric image of the right lung hilum and left lung hilum. On the right lung, the hilum consists of a single pulmonary artery, two pulmonary veins, superior and inferior. Bronchi are also two, superior lobar bronchus and principal bronchus. On the left side, the hilum consists of a single pulmonary artery, two pulmonary veins, inferior and superior pulmonary veins, and a single bronchus, which is a principal bronchus. Coming to the clinical correlation of a normal hilar appearance on the chest, right hilum and the left hilum. Hilar are visible on chest X-ray and they are highlighted above. A V-shaped represents where the pulmonary artery from the lower lobe meets the pulmonary vein of the upper lobe. This is a key radiological landmark. Coming to the hilar abnormalities, A represents the bilateral hilar enlargements, which is mainly due to the tuberculosis, sarcoidosis, lymphomas, pulmonary arterial hypertension, and metastatic malignancy. B represents the causes of unilateral hilar enlargement, which includes the lung cancer and metastatic malignancy. Example, the breast cancer.